Hey everybody, this is Dr. Langdon again, and tonight's video is just about some things I have been meaning to talk to y'all about. That is, on the internet these days, you can find sources of medical information from multiple places, and I need to teach you a few things about that. You know how usually on the beginning of my videos I say, hey, this is Dr. Langdon, board-certified pediatrician and fellow of the American Academy of Pediatrics, right? And there's a reason I do that, and that lends me authenticity. To be board certified means that I had to prove to a licensing board that I graduated from medical school. I had to prove that I completed a 3-year pediatrics residency. I had to pass the licensing exam. And I'm not bragging about me. I'm saying that's normal for all physicians who are staying in their lane and doing the things we're all supposed to do properly. So I want to teach you a few things. When you're believing as someone you see on the internet, I need you to stop and think. It's not stop, drop, and roll. Stop and think, and maybe look them up, maybe Google them, and see if they're board certified. See if they actually graduated from medical school. See if they completed a residency in their specialty, right? So if, I don't know, if a surgeon is lecturing you on something, an adult surgeon, that is very specific and pediatric, that's kind of weird because you won't see me doing any videos on topics that are in medical topics that are entirely out of my lane, right? I'm not going to teach you about adult psychiatry or the latest laparoscopic surgical techniques. That's not my lane. So, big red flag if they're not board certified, if they are not speaking within their lane. And here's an easy one, really for all different topics. If you were watching a video about medical topics and there's a code to follow, a link to click, a special percentage off, a coupon for their special magical go juice that's filled with magical components that cures everything, yet no, they're a grifter and they're trying to get your money. They're trying to separate you from your money. So I'm not selling anything. All the fantastic content creators who stay in their lane and are board certified aren't selling you anything. We're not selling you vaccines. And by the way, I think we pediatricians, rightly so, feel a little extra attacked when we're told that we're making millions off of vaccines when we know we're not, when we know the average practice either breaks even or actually loses money based on several studies that have been done about that recently. But it's not only pediatrics that gets attacked. Oncology doctors, a lot of grifters out there in the internet land are telling patients with cancer that they don't need to follow their oncologist recommendations. They just need their special fruity smoothie blend that can only be ordered for money on their link, right? Guys, none of that's based in reality or data or evidence or randomized controlled trials. That's just a product. And the sad part is they're using hope to sell it. Wouldn't it be nice if we could take one magical pill and melt our body fat overnight while we slept? That's just not how it works. So some common sense here. If it is too good to believe, it's just not true, okay? Now, I can tell you vaccines are awesome and they are proven effective and they are proven safe, and we have all the evidence and the data behind it to encourage them. And I want you to be very discerning when you're out there watching these videos and people are coming down with some ridiculous things they're blaming on vaccines. That's just not true. So there's one red flag for you. So we've covered a lot of red flags. If you're trying to research somebody, you can generally, like for peds, you can check the American Board of Pediatrics, ABP. You could also check to see if they're a fellow of the American Academy of Pediatrics, because you have to be board certified to become a fellow of the AAP. And you can often just Google them and you can see their credentials, maybe even some of their reviews and things like that. Tiny careful with some reviews, because sometimes if a physician's practicing good medicine, for example, and not prescribing antibiotics for a cold, because that would be bad medicine, if there were a disgruntled patient, maybe they could leave a bad review. So be careful if there are occasionally bad reviews. But for the most part, if physicians are connecting with their patients and they truly care about them and they form relationships and continuity of care, you hopefully will see some very appropriately good reviews for high quality physicians. I hope this has helped a bit. I feel strongly about this. I see sweet especially little old folks, even older than I am, sharing things sometimes on the internet or on social media. And I realize the content is very inaccurate and very wrong. And sometimes those older folks are particularly prone to believing some of this and even disinformation. Remember, misinformation is wrong, like this sweet little older person sharing something that's factually incorrect. But disinformation is the person who made that incorrect information and intentionally is spreading it. So please be careful out there to avoid the mis and the disinformation. Thanks, guys.